Under our health project, we have 13 primary healthcare centers all over Lebanon. As well, we have 6 mobile medical units. And we are working in approximately all the region in Lebanon. We're working from in the south, where we have 5 primary healthcare and 2 mobile units. And we're working in Beirut, in the suburb of Beirut, as well in the Bekaa, between the North Bekaa and the West Bekaa. We already choose the place based on the vulnerability and the people in need in that area. And those primary healthcare centers are being there for more than 20 years. The 3 main services that we are providing in all the centers are pediatrician, general practitioner, and OB-gynecologist. As well, we can add on them the cardiologist, and sometimes in some of the centers we have dentists. We have like an average between 1,000 to 1,500 beneficiaries per month, and let's say this is an average per center. Yet we have some of the centers who are seeing more than 3,000 per month in West Bekaa. So it depends on the location and the vulnerability of the location and the number of refugees living there now in this moment.
Basically, the aim of the MMU is to reach people who live in remote areas, especially in ITSs who are far and they cannot reach PHCs, in order to give them access to healthcare, basic primary healthcare services. The MMU team is basically composed of 4 people: a driver, a doctor, a generalist, a social worker, and a nurse. On a yearly basis, we do reach around 15,000 people with our services, only consultation, but if we need to add the awareness session, that would be almost double.
الو بعدك يا زلمه بعدك انا طلع هذه شايفها على يمينها وغرابه.
The mobile clinic has a schedule. Every day they have, on a weekly basis, go to a specific ITS in order to provide the services. We basically provide free consultations for everyone, Lebanese vulnerable populations and Syrian refugees living in the informal tented settlements. We as well provide medications for people in need, depending on the prescription of the doctor, for free as well. And we do refer people who need specialized care, whether medical or other sectors, in order for them to have specialized services. The social worker as well conducts individual counseling sessions, in addition to awareness sessions on different topics related to well-being and health. For example, for how to home treat flu or cold, or to how to prevent having such disease. Depending on the season, like in the winter we do something related to flu and cold and influenza. In the summer we do it for something related to the digestion system in the body, food poisoning and stuff like that, in addition to personal hygiene, family planning, how to take care of oneself in case they have diabetes or hypertension, and other topics as well.
Amel now is the representative of the local NGOs as well in Lebanon, so we are playing a main role in the health strategies in Lebanon, because now they have the Lebanon Crisis Response Plan, which is this nominated by the WHO, by the World Health Organization and the Ministry of Public Health, to respond to the Syrian crisis. So Amel now is the focal point of the local NGOs, to be able just to reflect the voices of what's happening on the ground, as well to try to have a minimal impact and try to help as much as we can in parallel with the Minister of Public Health. Our main target always is the beneficiary. We are always looking at the beneficiary, whoever is the beneficiary, as the main person that we want to get to him, we want to reach him, and we want to provide the best service for him. Our main goal is really to help the people in need in places where others cannot reach them.